These 7 common drinks are silently destroying your kidneys, causing irreversible damage. Do you have any of them in your refrigerator right now? Think twice before drinking. Your kidneys might be begging for help. Can you identify all the traps that are sabotaging your kidney health? Subscribe to the channel for more updates and enjoy this video if it is useful to you. There's another way to support our content. See the comments. Make a difference to someone's health by enjoying this video. Your collaboration helps us bring health information to more people. Kidneys play a vital role in maintaining the internal balance of our body. They are responsible for filtering waste and toxins from the blood, regulating fluid and electrolyte levels, and producing essential hormones for blood pressure control. However, kidney health is often neglected until the symptoms of dysfunction become apparent. Keeping your kidneys healthy is crucial to prevent chronic kidney diseases, which can lead to the need for dialysis or even kidney transplantation. Dietary habits directly influence kidney health. Excessive consumption of certain drinks can overload these vital organs, affecting their filtration capacity and contributing to the formation of kidney stones or the development of other renal diseases. Therefore, it is crucial to be aware of the drinks that can harm the kidneys, identifying and avoiding them in order to promote long-term renal health. Why is kidney health important? The kidneys perform essential functions in the human body, acting as natural filters that remove waste, toxins, and excess fluids from the blood, producing urine. Additionally, they regulate electrolyte levels, such as sodium, potassium, and calcium, and help maintain the body's acid-base balance. The kidneys also produce important hormones, including erythropoietin, which stimulates the production of red blood cells, and renin, which helps control blood pressure. Without proper functioning of these organs, the body cannot maintain its internal balance, leading to the accumulation of toxins and the development of various health complications. Compromised kidneys can result in several health issues, such as hypertension, anemia, and bone diseases. Moreover, the inability of the kidneys to adequately filter waste can cause chronic kidney disease, CKD, which often goes unnoticed in the early stages due to the lack of evident symptoms. In advanced stages, CKD can progress to kidney failure, requiring treatments like dialysis or kidney transplantation. Therefore, taking care of kidney health is vital to avoid severe complications and ensure the proper functioning of the body as a whole. Drinks that can affect the kidneys. Not all drinks are equal when it comes to maintaining healthy kidneys. Certain drinks, especially those high in sugars, caffeine, or artificial chemicals, can overload these vital organs. Sodas, energy drinks, industrial juices, excessive alcohol, detox and laxative teas, sugary drinks, and even excessive coffee consumption are some of the options that can harm the kidneys. Regular consumption of these drinks can impact the kidney's ability to effectively filter toxins, as well as increase the risk of developing kidney stones, hypertension, and other renal complications. Avoiding or limiting the intake of these drinks is essential to protect renal health in the long term. While they may seem harmless at first glance, continuous consumption can cause cumulative damage to the kidneys. Therefore, replacing these drinks with healthier alternatives, such as water, natural teas, and fresh juices, can help keep the kidneys functioning efficiently and prevent future problems. Let's explore each of these drinks and understand how they can quickly destroy your kidneys, surprising even those most conscious about health. Drink 1. Sodas, especially caffeinated. Sodas, particularly those containing caffeine, can be extremely harmful to kidney health. They are loaded with sugar, caffeine, and artificial chemicals that, when consumed in excess, can cause serious damage to the renal system. The high sugar content increases the risk of obesity and type 2 diabetes, two conditions directly related to the development of kidney diseases. Additionally, caffeine acts as a stimulant and diuretic, leading to increased urine production and potentially dehydrating the body, which overloads the kidneys and can contribute to stone formation. Scientific studies reinforce these risks. Research published in the Clinical Journal of the American Society of Nephrology found that daily consumption of sugary sodas is associated with a significantly higher risk of developing chronic kidney disease. Moreover, a study by Johns Hopkins University showed that regular consumption of caffeinated drinks increases the excretion of calcium and other minerals in the urine, a factor that can contribute to the formation of kidney stones. Another study published in the American Journal of Kidney Diseases found a link between soda consumption and a higher incidence of proteinuria, an early marker of kidney damage. In addition to the problems caused by caffeine and sugar, sodas contain artificial chemicals like colorings, sweeteners, and preservatives that can also negatively impact the kidneys. For example, studies suggest that the caramel coloring found in dark sodas may be carcinogenic and harmful to kidney tissue. Therefore, to protect your kidneys, it is crucial to limit or avoid soda consumption, opting for healthier alternatives like water, natural teas, and fresh fruit juices without added sugar. Drink 2. Energy drinks. Energy drinks are popular for promising a quick boost in energy and concentration. However, these drinks often contain an excessive amount of caffeine, in addition to other stimulants like taurine, guarana, and ginseng, which can harm kidney health. The high caffeine content in these drinks can lead to dehydration, overloading the kidneys and making it difficult for them to filter blood properly. Chronic dehydration can, in turn, contribute to kidney stone formation and the development of kidney diseases. Moreover, research indicates that regular consumption of energy drinks can increase blood pressure, one of the main risk factors for chronic kidney disease. The combination of caffeine and other stimulants causes an increase in blood pressure and heart rate, which, over time, can damage blood vessels in the kidneys, reducing their filtration capacity. A study published in the American Journal of Kidney Diseases showed that excessive caffeine consumption is associated with a higher risk of hypertensive nephropathy, a condition where high blood pressure causes kidney damage. Another worrying factor is the presence of large amounts of sugar in energy drinks. Excessive sugar consumption can lead to obesity and type 2 diabetes, both associated with an increased risk of kidney diseases. A study conducted by Harvard Medical School found that individuals who consumed sugary drinks, like energy drinks, regularly were significantly more likely to develop kidney disease. Given these risks, it is essential to avoid or limit the consumption of these drinks, replacing them with healthier alternatives like water, natural teas, or fresh fruit juices. Drink 3. Industrial juices. Industrial juices, often marketed as healthy alternatives, can pose a significant risk to kidney health. Most of these drinks contain an excessive amount of sugar, which can increase the risk of obesity and type 2 diabetes, both known risk factors for kidney diseases. Even juices labeled as natural or 100% fruit often include added sugars and preservatives, contributing to a daily intake that exceeds the recommendations of the World Health Organization, WHO. Excessive sugar consumption can cause damage to kidney tissue, gradually reducing the kidney's ability to filter toxins from the blood. Besides sugar, industrial juices contain a variety of artificial additives, like colorings, flavorings, and preservatives, which can also harm kidney health. A study published in the Journal of Toxicology found that some artificial colorings, such as red 40 and yellow 5, have the potential to cause kidney toxicity in animals. Preservatives like sodium benzoate can react with vitamin C present in juices to form benzene, a carcinogenic chemical compound that can also affect the kidneys in the long term. Furthermore, the presence of phosphoric acid in many industrial juices can contribute to kidney stone development. Research published in the American Journal of Clinical Nutrition showed that excessive phosphate consumption can lead to hyperphosphatemia, a condition characterized by high levels of phosphate in the blood, which can damage the kidneys and bones. Therefore, to protect kidney health, it is advisable to avoid industrial juices and opt for fresh juices made at home or consume fresh fruits directly, which offer fibers, vitamins, and minerals without the risks associated with excess sugar and artificial additives. Drink 4. Excessive alcohol. Excessive consumption of alcoholic drinks can cause a range of health problems, including kidney damage. Alcohol acts as a diuretic, leading to fluid loss through increased urine production. This diuretic effect can result in dehydration, impairing the kidney's ability to properly filter blood and remove toxins from the body. Chronic dehydration due to excessive alcohol consumption can lead to a buildup of waste in the blood and contribute to the formation of kidney stones. Moreover, alcohol can increase blood pressure, one of the primary risk factors for chronic kidney disease. Regular consumption of large amounts of alcohol can lead to hypertension, which damages the blood vessels in the kidneys, reducing their filtration capacity. Studies show that people with hypertension have a significantly higher risk of developing chronic kidney disease. Research published in the Journal of the American Society of Nephrology revealed that heavy alcohol consumption is associated with a higher prevalence of chronic kidney diseases, especially among individuals with a history of hypertension. Another concern is the risk of alcoholic nephropathy, a condition characterized by kidney damage caused by prolonged and excessive alcohol consumption. Alcoholic nephropathy can result in proteinuria, presence of proteins in the urine, and, in advanced cases, can progress to kidney failure. Furthermore, people already suffering from chronic kidney disease should avoid alcohol consumption, as their compromised kidneys struggle to process toxins. Therefore, to protect kidney health, it is crucial to limit alcohol consumption and, if necessary, seek professional help to reduce excessive drinking. Drink 5. Detox and laxative teas. Detox and laxative teas are often promoted as quick solutions for weight loss and detoxification. However, many of these products contain substances that can severely harm kidney health. Common ingredients like senna, cascara sagrada, and aloe vera have strong laxative properties that, when consumed regularly, can lead to dehydration and excessive electrolyte loss. This places additional stress on the kidneys, which need to work harder to maintain the body's fluid and electrolyte balance, increasing the risk of acute kidney injury. Moreover, some detox teas contain natural diuretics, such as horsetail and dandelion, which increase urine production and, consequently, fluid loss. This can result in chronic dehydration, especially if consumers do not compensate for fluid loss by drinking enough water. Dehydration can damage kidney tissue, reducing the kidney's ability to filter waste and leading to toxin buildup in the blood. People with pre-existing kidney diseases are especially vulnerable to the adverse effects of detox teas because their kidneys are already compromised. In addition to natural ingredients, some detox and laxative products contain synthetic chemicals that can also be harmful to the kidneys. For instance, certain colon cleansing supplements include magnesium oxide and other substances that can cause dangerous electrolyte imbalances when used excessively. Studies published in the American Journal of Kidney Diseases and the Journal of Renal Nutrition show that prolonged laxative use is associated with a higher risk of nephropathy and acute kidney injury. Therefore, it is crucial to avoid these products or use them only under medical supervision, prioritizing natural and healthy alternatives for kidney health. Drink 6. High sugar drinks. Sugar-rich drinks, such as sodas, industrial juices, and sports drinks, pose a significant threat to kidney health. The high sugar content in these drinks can lead to a rapid increase in blood glucose levels, resulting in a greater workload for the kidneys, which need to filter this excess. Over time, excessive sugar intake can cause insulin resistance and promote the development of type 2 diabetes, one of the main causes of chronic kidney disease. People with diabetes are at higher risk of diabetic nephropathy, a condition that impairs kidney function and can lead to kidney failure. Moreover, research indicates that excessive consumption of sugary drinks can contribute to obesity, another risk factor for kidney problems. Excess weight increases blood pressure and the risk of hypertension, placing more stress on the kidneys. A study published in the Clinical Journal of the American Society of Nephrology found a strong association between frequent consumption of sugary drinks and the incidence of chronic kidney disease. Researchers discovered that people who consumed more than 2 sugary drinks per day had a significantly higher risk of developing kidney problems compared to those who avoided these drinks. In addition to the effects of sugar, many of these products contain high fructose corn syrup, which can be especially harmful to the kidneys. Studies suggest that fructose can increase the production of uric acid, a byproduct that, at high levels, can contribute to kidney stone formation and the development of gout. Therefore, limiting the consumption of high-sugar drinks is crucial to protect kidney health. Opting for water, natural teas, or fresh juices in moderation are much healthier alternatives that can help keep the kidneys functioning optimally. Drink 7. Excessive coffee. While coffee, when consumed in moderation, offers some health benefits, excessive consumption can overload the kidneys. The main active component in coffee is caffeine, a stimulant that increases urine production. When consumed in large quantities, caffeine can lead to dehydration, forcing the kidneys to work harder to maintain the body's fluid and electrolyte balance. This additional effort can impair the kidneys, especially if the individual is already at risk of developing kidney diseases. Besides the diuretic effect, caffeine can cause a temporary increase in blood pressure. Studies published in the American Journal of Hypertension suggest that caffeine intake can raise blood pressure by up to 15 mmHg in people sensitive to the substance. Hypertension is one of the primary risk factors for chronic kidney disease because it damages blood vessels in the kidneys and impairs their filtration capacity. People who already suffer from hypertension or kidney problems should limit coffee consumption to avoid worsening these conditions. Another concern related to excessive coffee consumption is the presence of oxalic acid, a natural substance that can contribute to kidney stone formation. Oxalic acid, when combined with calcium in the urine, forms crystals that can group together and form painful kidney stones. A study published in the American Journal of Epidemiology found that high coffee consumption is associated with a higher risk of kidney stone formation, especially in individuals predisposed to this condition. Therefore, to protect kidney health, it is advisable to consume coffee in moderation, limiting intake to 2-3 cups per day and ensuring adequate water intake to prevent dehydration. Signs of kidney problems. Kidney problems often do not present clear symptoms in the early stages, making it essential to pay attention to subtle signs that indicate changes in kidney health. One of the first signs can be changes in urination patterns. This can include an increase or decrease in the frequency of urination, the presence of foam in the urine, indicating excess protein, abnormal color, or blood in the urine. The constant urge to urinate at night, nocturia, can also be an indicator of kidney problems. Another common symptom is swelling or edema, which can occur in the legs, ankles, feet, face, or hands. Compromised kidneys have difficulty removing excess fluids and sodium from the body, resulting in fluid retention. The presence of swelling, especially around the eyes, may indicate protein loss in the urine, a sign of kidney damage. Furthermore, the retention of toxins and waste in the blood can lead to extreme fatigue, lack of concentration, nausea, vomiting, and loss of appetite. Uncontrolled hypertension is another sign that may indicate kidney problems. The kidneys help regulate blood pressure, and their malfunction can result in high blood pressure, which in turn can cause more damage to the kidneys. Other symptoms include back pain or flank pain, muscle pain due to electrolyte imbalance, and dry or persistently itchy skin caused by toxin buildup. If you notice any of these signs, it is crucial to seek medical advice to assess kidney health and start appropriate treatment. Summary of kidney problem. Signs. Signs and symptoms of kidney problems often manifest subtly and can be confused with other conditions. One of the first signs is a change in urination habits, such as urinating more or less frequently than usual, especially at night. The urine may appear a different color, be foamy, or contain blood, indicating the presence of protein or red blood cells. Another common symptom is fluid retention in the body, leading to swelling in the legs, ankles, feet, or face. This occurs because damaged kidneys cannot efficiently remove excess fluids and sodium from the body. Additionally, extreme fatigue and weakness can also be indicative of kidney problems, as reduced production of erythropoietin, a hormone that stimulates the production of red blood cells, leads to a decrease in oxygen levels in the body. Other signs include nausea, vomiting, and loss of appetite, often resulting from the accumulation of toxins in the body. Back pain, especially on the side where the kidneys are located, and elevated blood pressure can also be symptoms of kidney damage. If you notice any of these symptoms, it is important to consult a doctor for proper diagnosis and treatment. Healthy alternatives. Instead of drinks that harm the kidneys, there are options that can promote kidney health. Water is the best alternative to keep the kidneys healthy because it helps remove toxins and reduces the risk of kidney stone formation. It is recommended to drink at least 8 glasses of water a day to keep the body properly hydrated. Coconut water can also be an excellent option. providing essential electrolytes and aiding hydration without adding refined sugars or artificial additives. Another healthy alternative is natural herbal tea, such as hibiscus tea and horsetail tea. Hibiscus tea can help reduce blood pressure, protecting the kidneys from hypertension-related damage. Horsetail is known for its mild diuretic properties, helping to eliminate toxins and reduce the risk of urinary tract infections. Avoiding caffeinated teas is important as they can overload the kidneys. Fresh fruit and vegetable juices are another option, especially if homemade and without added sugars. Cranberry and pomegranate juices are known for their benefits in preventing urinary tract infections. Carrot, beetroot, and cucumber juices are rich in antioxidants and anti-inflammatory compounds that help keep the kidneys functioning well. However, it is important to consume them in moderation due to their natural sugar content. Avoiding the 7 harmful drinks highlighted, caffeinated sodas, energy drinks, industrial juices, excessive alcohol, detox and laxative teas, high sugar drinks, and excessive coffee, is essential to protect kidney health in the long term. Continuous consumption of these drinks can overload the kidneys, leading to problems such as dehydration, stone formation, hypertension, and chronic kidney disease. Recognizing the signs of kidney problems and adopting healthier alternatives can make a significant difference in preserving these vital organs. We encourage everyone to rethink their dietary habits and choose drinks that promote kidney health, such as water, natural herbal teas, and fresh juices without added sugar. Small changes in daily habits can contribute significantly to preventing kidney problems and leading a healthier, more balanced life. Remember that kidney health is essential for the functioning of the entire body. Adopting healthy habits today can ensure healthy kidneys and a better quality of life in the future. Now that you know which drinks to avoid, how about taking a moment to reflect? Does your routine include any of these kidney traps? It's time to replace your choices with healthier alternatives. Remember, your kidneys deserve the best care. Want to know more tips to keep your organs in shape? Leave your like, share with friends, and subscribe to discover more secrets of a healthy life.